Hello, welcome back to the Quad Life and discussing Spinal Cord Injury Awareness Month for all of September. Well, we have talked a lot about various issues so far this month, and one that a lot of new people to spinal cord injury world question is longevity. So, how long does someone with a spinal cord injury tend to live? Well, it's not a real fun topic, of course, but it's one that a lot of people question, and it is one that I'll talk about today. So, when I was injured as a 3-year-old, the doctors originally told my parents that, well, maybe by the time he's 10, then he'll be walking again, the way that medical things are going. However, I was the same age, they said that about how long I would survive was to be about age 10, which is kind of a ironic thing, but obviously, now that it has been over 37 years since then, and I am 4 times the age of 10, well, those predictions thankfully weren't true. So, the real question is, what are the statistics and what are numbers? Well, for lower level injuries such as tetraplegia and below that, as long as someone takes good care of themselves, then really longevity is not that much different than someone without a spinal cord injury. It is a little bit less, but again, with good care, it's not. But the higher you go, then the more challenges you get along the way. So, in researching for this video, actually, data is pretty hard to find, and I'll show you a couple of things that I was able to find, and we'll go on from there. But the first thing we'll look at here is from the International Journal of Physical Medicine and Rehab. And, of course, the title is Life Expectancy in Spinal Cord Injury. And as I said, the importance of high-quality care. Now, I am not going to read this whole thing to you, and if I remember, I will put the link in the description down below. So, let's go down a ways here and look at what they say. Alright, partway down, we see SCI, or spinal cord injury, life expectancy calculations suffer several limitations. How long any given individual will live results from a plethora of factors, life expectancy calculations, which are based on the status of a discrete number of factors at a snapshot in time, are highly rigid in their analyses of longevity. They are incredibly limited in the data they incorporate into their assessments. For example, life expectancy calculator provided by the Life Expectancy Project accounts only for patient's name, sex, age, smoking habits, and whether one's health classifies as excellent, good, or average. In the case of SCI, medical schools disclaim that for any given individual, life expectancy calculators will not provide an accurate estimate of the number of years an individual will survive. Alright, so basically, that since we're hard to since people with spinal cord injuries are not as common, I guess, they don't do as much research. I guess that's good or bad, but let's go further down here and see what else they say. So life expectancy models likely underpredict. So though data on life expectancy in those with SCI are scant and suffer from a high degree of variability in the estimates they provide, there is significant evidence that overall survival in SCI patients has improved dramatically since World War II. Well, considering World War II ended nearly 80 years ago, I would hope things have improved since then. If they haven't, then that's a real problem, but maybe that's just me. But things are said that these advances are likely owing to advancements in understanding and management of the condition. And I do agree with that one, that in my lifetime, things have definitely improved for treatment, and in the last, say, 20 years especially, they have definitely improved. So we'll read one more section here, and then we'll move on to another site. So again, kind of redundant title, but longer life expectancies in those with SCI means SCI patients require longer term care. Well, kind of duh, if you're living longer, and you need to have care for a longer time. Despite improvements in longevity, fewer than 1 in 100 SCI patients have fully recovered functionality by the time they leave the hospital. And yeah, that's true. Pretty well any level injury that you sustain, unless it's very small and very low, then full recovery before returning home from your initial hospital stay. Yeah, I've never heard of it. So if it's less than 1%, I would definitely agree. So let's go down to the next paragraph here. Let's go to the top of your screen there. In addition to failing to recover fully, patients are now enduring chronic health conditions such as coronary artery disease, cardiovascular disease, and maturity onset diabetes, which had not before been recognized in this population because these patients did not tend to live as long as they do now. So I don't know the data exactly, but to me that sounds like most of the U.S. population that has problems with these already, from overeating and just our diet and different problems. So nothing new. Moving on. While approximately 90% of patients return to their homes following injuries, the patients are at high risk for secondary complications. The typical patient experiences between 8 and 14 complications each year, with common complications being pain, spasticity, urinary tract infections, or UTI, as I say, bowel problems, osteoporosis, respiratory difficulties, autonomic dysreflexia, which we already covered, and pressure ulcers. As I've said in previous videos, then secondary problems are a big thing to worry about. And again, this is reflected here. And these are the items that need to be taken care of, especially with long-term injuries. So I was able to find one place that actually did give statistical data. And from the looks of it, it's rather outdated, but it is a list to say the least. This is from the National Spinal Cord Injury Statistical Center, or NCSSC. Now, unfortunately, the data here is behind my head for you, so let me loosen a few screws and I'll take my head off a minute so you can see. Alright, I'm now headless. So these numbers here are kind of odd, but let's look at them here. Life expectancy for post-injury by severity of injury and age of injury. So on the left we have for persons who survived the first 24 hours, which if you didn't survive the first day after injury, then why are we looking at stats for that anyway? But let's take a look here. On the left we have age of injury of 20, 40, and 60. And again, I was injured at age 3. So these data really don't apply to me that much. But on the left side of the bar here, if we go clear over to the right, that for someone who is event dependent, that if they are injured at age 20 and obviously survived the first day, then their life expectancy is 10 years. Okay. And then over on the right side, we see for persons surviving at least 1 year post-injury, which again sounds rather odd. If you aren't living 1 year, then well, to get up to 10 for the data on the left, but whichever. So the top column, someone that is injured at age 20 and survives for more than a year, they're an event-dependent person like myself. Their expectancy is 17.1 years. Now, if we look at the next column of 40, then the life expectancy goes down to 13.1 years. So there's a 4-year difference between those two. And since I was injured at 3, let's just call that 0 for these statistics, since they do every 20 years. Since the difference between 20 and 40 is 4 years, I will add on 4 years to the youngest age, which would be average age of 21 years. Alright, let's put my head back on. There we go. That feels better. So according to this table, life expectancy for someone around my age, that was injured around my age, would be about 21 years. And I am now 37 years post-injury. So that's a bit of a difference. So, what do we know from this data? Well, from my own experience, I know that whenever I have seen new statistics that I've already long outlived whatever comes. However, looking around, I only know 2 other people with my level of injury and event dependent that have lived longer than I have. One of them lives in Nebraska and has 1 more year on me, so he has been injured for 38 years. And the other one is a man who lives in Maine and he has 4 years on me, or has survived for 41 years. I'm guessing there are more of us, but those are the people that I know of. And I know several people that have passed away at around 30 years post-injury. However, in the last 3 years, I know of at least 3 children that were injured at young ages of, say, 2, 3, or around that age, that did not survive to their late teens. So they only lived, say, 10 years or less past their injury. So when looking at just the people I know, then life expectancy is shorter. So those are the numbers, and as a result, a lot of people with spinal cord injuries, especially high-level ones like myself, do something called advanced directives, or something that is in the case of a medical problem that I cannot speak, or the person can't, then these directives take over, and then someone that has been designated can say what to do or not. And a lot of people have something done that's what's called DNR, or do not resuscitate. So that is the case of if the heart stops or something of that sort, to not do any kind of CPR, that kind of thing. If you have paid attention in some of my older videos, that I wear a bracelet on my left arm that says just that, do not resuscitate. And I sometimes even wear a second one on my lower legs, just if, especially I'm wearing long pants or that kind of thing, or long sleeves that you can't see my arm. So it's not giving up on life, but it's kind of saying, this is what a person has decided or not. However, as a Christian, I know that all things are in God's control, no matter what bracelets or paperwork I have in place. So ultimately, it's up to Him. And when I see someone pass away that has not had anywhere near the years I've been given, I do kind of wonder why I've been given more. But I am very thankful for what I have been blessed with, and I try to continue to be active and use whatever time I've been given for God's will and to serve Him. And I also am very careful for health-wise, and have been very blessed with caregivers that do a lot for me. Those that I know personally that have passed away in recent years, most of them have been from cancer or something like ALS, or some kind of symptom or diagnosis that has had nothing to do with spinal cord injury. So I'm not sure if that's good or bad, but it's something to note. But as always, thank you for following along. As I said, this is not the funnest of topics, but it's something that a lot of people ask, so I wanted to at least address it today. But tomorrow we'll go on to something else. So thanks again for tuning in, and bye for now.